And welcome back. I'm Mabel Jong, and I'm so very pleased to have a very special guest in the studio today. The author of The Price We Pay, Dr. Marty Makary is here, and it's, as I said, The Price We Pay, What Broke American Healthcare and How to Fix It. Dr. Makary, thank you so much for your time today.
Great to be with you, Mabel.
So great to be with you, and you talked a little bit about how this book came about. You actually went on the road to talk with physicians and people who pay for health care to get the real story behind what we're paying for. Is that right?
Yeah, I really wanted to understand healthcare costs from the ground and talk to executives from pharma and hospitals and insurance companies and listen to their struggles and listen to their goodwill and what they want to do better, but what they're stuck doing wrong because the system won't allow them to. So I really got inspired in finding the disruptors out there who are changing healthcare. But probably in the 2 years in which I visited, I think, 22 different cities, the perspective that I was most struck by is that of the patients. You know, half of America does not live like me. They have less than $400 in savings, and they live paycheck to paycheck. And right now, people are getting hammered out there with their medical costs and their high deductibles and co-pays. These are all new things. Massive deductibles of $10,000 when you work and have insurance. And the people are getting crushed with their medical bills that they cannot interpret, for which they can't get a price quote on, and they're getting hit with surprise bills at in-network hospitals from out-of-network doctors. People are getting hammered right now with their medical bills.
Was it particularly shocking to you because you're used to being in a surgical suite, somewhat shielded from what's going on in the outside world?
In medical school, we're taught medical literacy. We're not taught anything about healthcare literacy. And it turns out that's an entire discipline that many of us have become self-taught in. And I had to do that in my role as a professor of health policy at Johns Hopkins, but there's no textbook for a lot of stuff. You've got to talk to the startups and the disruptors and the big heavyweight companies, the captains of industry and insurance and hospitals, and talk to them and find out what's gone wrong. Because I'm convinced, Mabel, that everybody goes into healthcare for great reasons. We are all attracted to this field at every level, nursing, hospital administration, insurance, you name it, out of a sense of compassion. And medicine has an incredible heritage. I mean, if you look at the icons of medicine and how they took care of people regardless of their ability to pay, if you look at the charters of the great American hospitals, it is written in there that they would be a safe haven for anyone who is sick or injured, regardless of their race or creed or financial ability to pay. That incredible heritage, that public trust is being eroded today because of the predatory billing and appropriateness crisis that we have in healthcare. Most doctors do the right thing and always try to.
Okay.
But what we're seeing is a crisis of appropriateness in healthcare, overtreatment, some undertreatment, access, care coordination, cracks in the system. What I would summarize as care coordination and appropriateness issues, and then the pricing failures that have opened the floodgates to price gouging, which unfortunately has become a business model in some parts of healthcare.
Well, you referred to it as predatory pricing. Where does that stem from? Somebody's writing those prices down on a list. So who is that?
Well, you know, it's a network of poorly aligned incentives. And I got that term, predatory pricing, from the subprime mortgage industry, because you had people that went into the mortgage broker industry to help guide people who are buying new homes, young couples, to put them in the right mortgage for them. But the massive perverse incentives drove them to put them in what were really inappropriate or subprime predatory loans. And so if that was a problem in 2008 when the system collapsed, we have a far bigger problem in healthcare today. We've seen all sorts of middlemen grow in the system, tremendous clinical waste, administrative waste, it's not depressing. I'm optimistic at what's happening because the disruptors are saying, let's go direct. And we've heard at this healthcare conference about direct primary care and direct purchasing and value-based bundles and the success of price transparency-driven medical centers. They're having tremendous success, and they should.
Well, yeah, I mean, seems to be quite a bit of dire news in the book, but you also offer some more good news. Can you outline some of the good things that you found?
Well, I think a lot of people are standing up and saying, we want to do business differently. When you talk to employers, they're saying, why can't we have a competitive landscape where we can encourage our employees to go somewhere and get a better value? Let me give you an example. Adam Rousseau in Boston tells his employees who are delivering babies at both the $8,000 hospitals in Boston and the $40,000 hospitals in Boston, both with equal quality scores, but delivering a baby at an $8,000 hospital is a much better value, recognizing the equal quality. He is offering free diapers and wipes for a year to his employees if they go to the $8,000 hospitals in the Boston area. So when you look at a marketplace like delivering an uncomplicated vaginal delivery in Boston, how much is that medical service? It ranges from $8,000 to $40,000. Why? What's the problem? Can we talk about this as doctors? Can we talk about why are you at the $40,000 level and why? Now, if the quality is 3 times better, that's fine, but that's not true. So we're seeing people come up with creative incentives that don't tell people you can only go here, and they're not authoritarian. But instead they're saying, hey, let's get transparency and let's create the right nudges and carrots to encourage good decisions. You know, there's a heart surgeon, I believe in Indiana, who called 100 heart surgery hospitals and asked, how much is a heart operation, open heart standard CABG? The answer was $40,000 to $500,000, and only half the centers could give him an answer. Right. He then correlated the outcomes of those centers in the National STS database, one of the most mature public registries of heart surgery outcomes, with the price, and there's no correlation. So there's a tremendous amount of waste that can be cut with good, honest competition in healthcare.
Well, in your journey to speak with all of these different people, what did the physicians say who have for years felt that they had to go for a fee-for-service model because that's how they would be paid well? So what is their answer to the questions that you're asking today?
I think we physicians, should be paid well for the work done. But what's happened is burnout rates have reached astronomical levels, record highs, and doctors are saying, take me off this fee-for-service treadmill. I don't want to be held to monthly quotas like a car dealer might be held to do certain operations. Let me practice medicine in the art in which it was intended to be practiced, customizing treatments to individuals and their goals and their needs, and take me off this treadmill. And so we've seen medical centers make the switch over to share risk. We've seen in the state of Maryland a globally capitated system. Probably one of the most exciting things I saw in doing the research for the book, The Price We Pay, was the globally capitated primary care growth in the United States. The IORAs, the ChenMeds, the Oak Streets that say, look, we're primary care, we're going to pay our primary care doctors well, and we're going to take the downstream financial risk of a population because we know the specialists that are doing appropriate care, and we know the specialists that price gouge to steer away from them, and we can manage the patient downstream if you just let us practice without the treadmill of the billing game. I don't think doctors are lazy people. We just don't want to spend our time on things that don't matter. And paying doctors fairly and with a globally capitated value-based system where the metrics are real, they're not the raw, simple, easy to measure things like just readmissions and infection rates, but they're actually measures of appropriateness, and they ask patients about their outcomes, what we call PRO, patient-reported outcomes. So that's some of the exciting stuff I've been learning about in the research for the book.
What's the one thing you want people to get out of your book?
I think for business CEOs that most of you are getting ripped off on your benefits, on your health insurance, on your PBM benefits, and you should talk to an independent advisor who can help restructure your benefits. And there's a lot of money to be saved there. I showed how Ohio, just the government in Ohio on their plan saved $230 million overnight.
Wow.
There's a tremendous amount of waste.
Yeah.
For doctors, let's remember our mission. Let's look at the charters of our hospitals and remember our mission to communities and to serve people. And for patients, it's ask questions, be informed, and shop around. And for insurance companies, we're your friends. We are partners to try to achieve the same value proposition. Let's not have the adversarial relationship where the micromanaging of patients costs more than any savings it delivers.
All right, Dr. Makary, I'm so glad you're here at this conference. How are you finding it so far?
It's a great conference, a lot of great people. I just saw Anish Chopra and we caught up, and so there's a lot of tremendous minds here and a lot of talent, and so it's great to see everybody, and I think this is one of the better healthcare conferences out there for hearing new ideas and for listening to such a vast array of people. You know, it's hard in healthcare in the establishment community, that is sort of the healthcare expert panels, to find people that are truly unbeholden to special interests and stakeholder interests. And I think here you hear from everybody, and that's the conversation we need. We need an honest conversation with every single stakeholder at the table. And so that's what I love about seeing my friends here from hospitals and insurance companies and other industries.
Great. Dr. Makary, thank you so much for your time today.
Great to be with you, Mabel.
And thank you for tuning in. Stay tuned. We have much more to come.